you for watching this presentation of the Opioid Utilization Report Overview for Medicare's Shared Savings Program and Next Generation ACO model. This communication material was prepared as a service to the public and is not intended to grant rights or impose obligations. It may contain references or links to statutes, regulations, or other policy materials. The information provided is only intended to be a general summary. It is not intended to take the place of either the written law or regulations. We encourage readers to review the specific statutes, regulations, and other interpretive materials for a full and accurate statement of its contents. In this video, we will cover several topics: opioid utilization reports, the Medicare Part D Overutilization Monitoring System or OMS criteria, and the 3 Medicare Part D patient safety opioid measures, as well as additional resources. But first, an introduction to the reports. On the next few slides, we will cover the content and background of the new Informational Opioid Metrics Reports for ACOs. Beginning in July 2019, CMS will provide ACOs with a Quarterly Opioid Utilization Report. This report provides information on ACO-assigned beneficiaries using the most recent available assignment who were enrolled in a standalone Medicare Part D prescription drug plan, or PDP, and who were outliers who met the Overutilization Monitoring System criteria and/or one or more of the 3 opioid use quality measures from the Pharmacy Quality Alliance. The information provided in these reports only applies to beneficiaries who have Part D coverage. There could be other beneficiaries with high utilization who do not appear on the reports because they do not have Part D coverage. This report will be provided for informational purposes only and is not part of the annual quality performance score. Additional details on how to access the reports will be included in the Spotlight newsletter and NG-ACO newsletter when the report is available. Beneficiaries are included in the opioid utilization reports if they met criteria for one or more of the following metrics. These include Medicare Part D Overutilization Monitoring System or OMS criteria, or any of the 3 Medicare Part D patient safety opioids measures adapted from the Pharmacy Quality Alliance or PQA, which include the use of opioids at high dosage in persons without cancer, or OHD, the use of opioids from multiple providers in persons without cancers, or OMP, the use of opioids at high dosage and from multiple providers in persons without cancer, OHD-MP. Next, we will review the content that will be delivered in the opioid utilization reports you receive each quarter. After, we will cover the specific measures in more detail. Table 1 reports the total number of beneficiaries that were identified in your ACO for each measure. It also provides the mean and median number of beneficiaries identified across all ACOs in either the Medicare Shared Savings Program or Next Generation ACO model. Table 2 is at the beneficiary level and lists demographic information of beneficiaries, including their name and Part D contract information. It then indicates which measure criteria that the beneficiary was identified as meeting. If a beneficiary was identified by one or more measure criteria, then Table 2 also includes how many healthcare providers prescribed opioids to them, as well as the NPI numbers of up to 6 providers who prescribed opioids to that beneficiary. It is possible that an ACO will not have any beneficiaries that meet the criteria for any of these measures. When this occurs, no beneficiaries will be included in Table 2. The next slides will cover and explain the Part D Overutilization Monitoring System criteria. The first member-level flag in the Opioid Utilization Report identifies beneficiaries who met the Overutilization Monitoring System or OMS criteria. The OMS criteria identifies beneficiaries who received opioid prescription claims with an average morphine milligram equivalent, or MME, daily dose of greater than or equal to 90 milligrams during the past 6-month measurement period and either received opioids from greater than or equal to 3 prescribers and greater than or equal to 3 pharmacies, or from greater than or equal to 5 prescribers regardless of the number of dispensing pharmacies. The daily dose is calculated across all opioid prescriptions with dates of service within the measurement period and is standardized to morphine milligram equivalents. These steps and equations used for calculating the MME are presented in future slides. CMS counts prescribers who have the same single taxpayer identification number in the Medicare Provider Enrollment Chain and Ownership System, or PACOS, as a single prescriber. The measure refers to any provider who prescribes opioids and is not specific to ACO providers. The next slide lists the beneficiary exclusion criteria. Beneficiaries who have Part D coverage are excluded if, during the 6-month measurement period, they meet any of the following criteria. They are a resident of a long-term care facility or intermediate care facility based on the resident code on the prescription drug claim within the measurement period. They have a cancer diagnosis. They have a palliative care diagnosis on at least one inpatient or at least 2 outpatient claims. They are enrolled in hospice or they have died. Note, we look back 1 year to identify cancer. To demonstrate the MME conversion factors, we've listed the values for an array of prescription drugs. Morphine is the standard with a conversion factor, or CF, of 1. As you can see, some opioids are stronger, such as oxymorphone with a CF of 3. And others are less potent, such as tramadol with a CF of 0.1. Methadone has 4 conversion factors based on the daily methadone dose. The MME conversion factors standardize the varying potencies of different prescription opioids so a beneficiary's average opioid daily dose can be determined. The MME conversion factors maintained by the CDC are intended solely for research, surveillance, and other monitoring purposes and not for clinical decision-making. The calculation to determine whether a beneficiary meets the 90 mg or greater MME daily dose criterion requires several steps. These steps are discussed over the next 3 slides. First, not all opioids are included in the MME calculation. Exclusions include opium tinctures, cough and cold products, and non-oral dosage forms, for example, powders, topical, intravenous, intrathecal, epidural, or injection, with the exception of buprenorphine subcutaneous pre-filled syringe. Opioid products containing buprenorphine are excluded from the average MME calculations, but are included when determining the number of opioid prescribers and pharmacies. For each beneficiary, once the opioid claims are identified, the non-methadone opioid and methadone claims are identified. For non-methadone claims, we standardize each prescription opioid to the morphine milligram equivalent. This requires us to determine the daily dosage units per day per claim and then calculate the total morphine dose using a conversion factor that converts the specific opioid claim's dose to morphine milligram equivalents, or MME. The daily MME is then summed across claims for each day. Calculating MME for methadone requires the same first 2 calculations plus 1 extra step where the methadone dose is summed for each day prior to applying the methadone conversion factors, as described in the next slide. For methadone claims, once the daily methadone dose is summed for each day, depending on the dose, that value is multiplied by the appropriate graduated methadone MME conversion factor. If the methadone daily dose is 35 mg for that day, the conversion factor used is 4. If the dose is 45 mg, the conversion factor increases to 8. To calculate the total daily MME for a beneficiary, both the non-methadone and methadone total daily MME is summed for each day of utilization. To calculate the average MME for a beneficiary, the total daily MME is summed for all days within the measurement period. The duration of the opioid use is determined by calculating the number of days between the first and last day of opioid use within the measurement period, inclusive of first and last days of utilization. By calculating a daily MME and limiting the total MME to days within the measurement period, any day supply or quantity dispensed beyond the measurement period is excluded. Finally, the average MME is calculated by dividing the total MME within the measurement period by the duration of opioid usage. If a beneficiary has an average MME greater than or equal to 90 mg and meets either the 3 or more opioid prescribers or dispensing pharmacy count, or 5 or more opioid prescriber count criteria, the beneficiary meets the OMS criteria. The report includes the number of individual assigned beneficiaries in the ACO with Part D coverage who meet the inclusion criteria and are not excluded based on the exclusion criteria as identified in the ACO Opioid Utilization Report. Now we will move on to the next section of the presentation on the 3 Medicare Part D patient safety opioid measures. These measures are adapted from the Pharmacy Quality Alliance, or PQA, measures that have been endorsed by the National Quality Forum, or NQF. The 3 measures are the use of opioids at high dosage in persons without cancer, or OHD, the use of opioids from multiple providers in persons without cancer, or OMP, and the use of opioids at high dosage and from multiple providers in persons without cancer, or OHDMP. CMS provides Part D sponsors, i.e. contracts, with monthly reports with information related to the opioid measures. The medications included in these measures can be found in the NDC medication list maintained by the PQA. Opioid prescriptions are not limited to those written by ACO providers. While the inclusion criteria defining the denominators of the 3 measures is the same, the numerators are different. The Medicare Part D patient safety opioid measures, which we have calculated at the ACO level, are defined in this and the following slides. OHD is the percentage of Medicare Part D beneficiaries 18 years or older receiving prescriptions for opioids with an average daily morphine milligram equivalent greater than or equal to 90 milligrams over a period of 90 days or longer. The numerator for the OHD patient safety measure is the number of beneficiaries eligible for inclusion in the measure with an average MME greater than or equal to 90 milligrams. The MME is calculated similarly to OMS. However, unlike OMS, methadone has a single conversion factor of 3. The MME includes a similar drug list to OMS, but also excludes medications containing buprenorphine. OMP is the percentage of Medicare Part D beneficiaries 18 years or older receiving prescriptions for opioids from 4 or more prescribers and 4 or more pharmacies within 180 days or less. The numerator for the OMP patient safety measure is the number of beneficiaries in the denominator who received opioids from 4 or more prescribers and 4 or more pharmacies within 180 days or less during the measurement period. Claims for buprenorphine are not used to calculate the number of opioid prescribers or dispensing pharmacies. OHD-MP is the percentage of Medicare Part D beneficiaries 18 years or older receiving prescriptions for opioids with an average daily morphine milligram equivalent greater than or equal to 90 milligrams over a period of 90 days or longer, and who received opioid prescriptions from 4 or more prescribers and 4 or more pharmacies within 180 days or less. The numerator for the OHD-MP patient safety measure is the number of beneficiaries in the denominator with an average MME greater than or equal to 90 milligrams during the measurement period and who received opioid prescriptions from 4 or more prescribers and 4 or more pharmacies within 180 days or less during the measurement period. The denominator or inclusion criteria for the patient safety opioid measures for OHD, OMP, and OHD-MP is the same for all 3 measures. The denominator for these Medicare Part D patient safety opioid measures is the number of enrolled beneficiaries who are 18 years or older with at least 2 fills of a prescription opioid on unique dates of service, and at least 15 total days supply over a period of 90 days or longer during the measurement period. The exclusions for these patient safety opioid measures are a diagnosis of cancer or a prescription drug hierarchical condition category of 15 through 19, and hospice enrollment or place of service codes. The OHD measure identifies the number of beneficiaries assigned to or aligned with the ACO with Part D coverage who met the overall opioid inclusion criteria and who have an average daily dose of greater than or equal to 90 MME for greater than or equal to 90 days during the measurement period. The OMP measure identifies the number of beneficiaries assigned to or aligned with the ACO with Part D coverage who met the overall opioid inclusion criteria and have prescriptions for opioids from greater than or equal to 4 prescribers and greater than or equal to 4 pharmacies within less than or equal to 180 days during the measurement period. The OHD-MP measure identifies the number of beneficiaries assigned to or aligned with the ACO with Part D coverage who met the overall opioid inclusion criteria with an average daily dose of greater than or equal to 90 mme for greater than or equal to 90 days and have prescriptions for opioids from greater than or equal to 4 prescribers and greater than or equal to 4 pharmacies within less than or equal to 180 days during the measurement period. The OHD-MP criteria is in the intersection between the OHD and OMP criteria within the overall opioid inclusion criteria. We described the OMS criteria and the 3 NQF-endorsed opioid metrics included in the report. We would like to note that, as displayed in this table, they have different measurement periods. The OMS criteria is applied to a rolling 6-month period that shifts by 3 months with each quarterly report. The July 2019 report used prescription and other claims with dates of service from October 1, 2018 through March 31, 2018 that were submitted and processed through April 30, 2019. The September 2019 report includes the first 6 months of 2019, and the December report uses claims with dates of service from April 2019 through September 2019. The 3 NQF-endorsed opioid measures are limited to dates of service within a calendar year, and each report adds an additional 3 months of data until the full year is reported. Each March report includes a list of beneficiaries who met the measure criteria any time during the full prior year. The July and September reports only include the first 3 and 6 months of claims during the current report year, respectively. Let's review a case scenario. In this scenario, we will determine whether from this example the individual would be included in the measures. Fred is a hypothetical Medicare fee-for-service beneficiary with Part D coverage during the measurement period assigned to an ACO. He does not have a diagnosis of cancer during the measurement period and is not enrolled in hospice. Fred has 1 prescription for an eligible opioid with a 21-day supply during the measurement period. Is Fred included in the OHD measure per the inclusion and exclusion criteria as identified in the ACO Opioid Utilization Report? The answer is no. He would not be included in the measure. Why is that? First, although Fred does not have a known exclusion, such as a cancer diagnosis or hospice enrollment, and his prescription exceeds a 15 total day supply, he has only 1 opioid prescription fill during the measurement period. A beneficiary would need at least 2 fills of a prescription opioid on unique dates of service and at least 15 total days supply over a period of 90 days or longer during the measurement period to be included in the measure. In another scenario, Joan is a hypothetical Medicare fee-for-service beneficiary with Part D coverage during the measurement period assigned to an ACO. She does not have a diagnosis of cancer, is not receiving palliative or hospice care, and is not a resident of a long-term care or intermediate care facility. She has filled 3 prescriptions for eligible opioids written by 3 different providers and filled at 3 different pharmacies. Joan has an average daily dose of 90 mme for 120 consecutive days. Is Joan included in any of the measures? The answer is yes. She would be included in the OMS and OHD measures. She qualifies for these because of her high daily dose of 90 mme for equal to 90 days, and because she had 3 prescriptions written by 3 different providers and filled by 3 different pharmacies during the measurement period. She did not have enough prescribers or different pharmacies to be included in the OMP measure, and therefore would not be included in the OHD-MP measure either. This concludes this video on opioid utilization measures and opioid utilization reports for ACOs. Thank you for watching. For additional guidance and resources, please see the Shared Savings Program website and portal and the Next Generation Connect site. More information on Medicare Part D opioid policies can be found in the Medicare Learning Network MLN Matters article number SE18016, a prescriber's guide to the new Medicare Part D opioid overutilization policies for 2019. Additional resources about Part D policies and performance data are available at the links listed here.